Hi, I'm Dr. Radhakrishna. This is IMU research. The project is about systemic review, methyl folate and folic acid. It is 5-methylene tetrahydrofolate acid, folic acid. It's more effective than synthetic folic acid in the increasing folate concentration in women. The mechanism of folic acid it conjugates with the folate conjugate and the folate receptors on the surface, and we can clearly see how it has gone into the cell through the endosomes and then part of the lysosomes, and how it enters the cell of a human. Why L-folate, L-methyl folate? Why? Because if you look at a synthetic folate, folic acid, it has to go through several steps to become an active component, which is the L-methyl folate. So it has to go through to converts to dihydrofolate, then to tetrahydrofolate, then to 10-methyl folic tetrahydrofolate, to 5,10-methylene tetrahydrofolate, to 5,10-methylene tetrahydrofolate, to L-methyl folate. In comparison to methyl folate, it is directly bioavailability maybe between approximately 7 times. But if you look on the left side, there can be a methyl tetrahydrofolate reductase challenge, or there can be a polymorphism which prevents a conversion of synthetic folic acid to an active component of L-methyl. In these Annals of Nutrition and Metabolism, and the article written in August 25th, 2010, we find, the prevention of a neural tube defect with preconceptional folic acid, methyl folate, and multivitamins. What's interesting in this topic is that they written the 4 possible uses of preconceptional folic acid and multivitamin supplements. The first is the dietary intake. Second is a preconceptional supplement. The third one is the flour fortification. And the fourth one is the recent attempt of use of oral contraceptive with 65 to 65.5 methyl tetrahydrofolate has been discussed. And of course, the general conclusion is its prevention is better than cure, because it prevents more of termination of pregnancies due to neural tube defects and fetuses. This is an article from PubMed, and with the title of Multivitamin Supplements During Pregnancy, Emphasis on Folic Acid and Methyl Folate. And I'm just taking a part of the research paper to tell us a discussion that there could be a possible 40 to 60% of the population may be having genetic pleomorphism, and that impairs the conversion of folic acid to an active form. So the active form is L-methyl folate. So during the final stages of enzymes of methyl hydrofolate reductase, the certain pleomorphism may be inadequate, have inadequate MTHR activity. So based on this high genetic pleomorphism, the pregnant lady may be getting adequate folic acid, but conversion may be less. So the better option, according to this article, is that L-methyl folate is a best option to avoid blood folate deficiencies, and this way it also prevents or decrease amount of neural tubal defects in pregnancy. This is the folic acid cycle, and if you look very closely, you see the cycle is methionine to homocysteine or homocysteine to methionine, and it requires vitamin B12 and zinc component. And from here, it gives out 5-methyl tetrahydrofluoride for folate, and 5-methyl 5,10 methylene tetrafolate gives away 1,5 methyl tetrahydrofolate, and this is the folic acid cycle. And during this process where synthetic folic acid is added on, and we can also clearly notice a folic acid trap. This is from International Journal of Molecular Sciences. Neural tube defect and folic acid deficiencies. Is DNA repair defective? It's already a known fact. This is a publication from 22 January 2023. Neural tube defects are as a result of failure for the neural tube to close during embryogenesis, and it could be an interaction between it is an interaction between genetics and the environmental factors. And it's already a well-known fact that folic acid deficiency leads to increased amount of neural tube defects. And these defects could be due to DNA hypomethylation, or also it can be blocked by the synthesis of 2-deoxythymidine 5 monophosphate, an increased amount of uracil misappropriation, incorporation, and it causes a genomic instability. And it's already a proven fact. And to tell that folic acid is required for all pregnant ladies or pre-pregnancy, to be very sure. This diagram shows us about the neural tube defect during the embryogenesis, and it can be an anencephaly, it can be encephalocele or spina bifida, usually in the 3rd week, 6th week, or the 9th week. During the fusion period of neural tube defect formation, it could be 18th day post-fertilization, or 24th day of post-fertilization, 35th day of post-fertilization, or the 4th month post-fertilization. But what we are focused is usually between the 21st day to 28th day. This is the crucial period of time where the neurulation defects occur. So by adding 4 milligrams or 5 milligrams of folic acid daily prevents 75% recurrent neural tube defect compared to a control group. Neural folds can start to elevate on the 19th day after conception. The fusions of the top part begins on the day 21 and 22 days later. Uh, if not completed by the 28 days, that's when the neural tube defect occurs, and that results in spina bifida, encephalocele, and anencephaly. And this study is aimed to provide a comprehensive understanding of folic acid or folate metabolism and the potential benefits of 5-methyl tetrahydrofolate as a possible supplement to reduce the risk of neural tube defects. This is an article from the Journal of Perinatal Medicine. It talks about the 5-methyl tetrahydrofolate, an alternative to folic acid in the prevention of neural tube defects. And here this argument was very simple. He said one of the other problems of neural defects can be low methyl folate. Second, it can be the bioavailability. Third is that folic acid has no natural, no biological function per se. It has to be converted to or reduced to active component from dihydrofolate to tetrahydrofolate before it becomes a useful component in the prevention of neural tube defect. So their argument was that if we were to give a direct natural component like 5-methyl tetrahydrofolate, which will be a better alternative to folic acid. So those countries have not adapted the fortification program. It's better to introduce 5-methyl tetrahydrofolate. Can be effectively to improve folate biomarkers in young women in early pregnancy to prevent neural tube defects. Methyl tetrahydrofolate reductase isoform carrier. that's methyl 5-methyl tetrahydrofolate versus folic acid, and they studied around 30 cases, and these 30 cases had recurrent fetal loss, premature uh, termination of pregnancies, or abnormal sperm parameters. So most of these 30 patients have failed. So three-quarter of them failed due to during the failed assisted reproductive trials, and the dosage was given as 5 milligrams of folic acid daily. But subsequently, what they did is they have replaced the entire uh, dosage using methyl tetrahydrofolate, 60 micrograms per day during the 74 days of sperm activity, spermatogenesis, entire cycle of spermatogenesis. The result was very simple. The conclusion was that the methyl tetrahydrofolate was able to bypass the methyl tetrahydrofolate reductase blockage. As a result, most of them have become pregnant. This is a data of spina bifida done with the patient information from UMMC, or Malaysian Medical Center in Malaysia, and they capture the data of the spina bifida, and these patients were involved in the data between the period of 2003 and 2016, or the born in UMMC during this time frame. And of the recorded patients, around 86% with spina bifida was analyzed, and the prevalence rate was around 1.87 to 8.9 per 100 per 1,000 live births. And they were also ethnically divided into the Malay, the Chinese, and the Indians. This is a publication from American Public Health Association in January 2016, which shows folic acid fortification, and it's a systemic review and meta-analysis. In this publication, they did a systemic review, meta-analysis, and PRESMA, and they done 4,078 studies, and they identified around 179 studies in a systemic review plus meta-analysis. And they found that geographically live births, they found spina bifida prevalence like approximately almost like 33 to 100,000 live births versus voluntary 48 live spina bifida in 100,000 live births, where the fortification has not been legalized and or enforced in some of the Asian countries and European countries. The long-term study done on spina bifida, open study on spina bifida by British Journal of General Practitioners. These are the findings. The mean age of survival is around 30 years. There were more than around 117 consecutive cases of open spina bifida, cohort studies, and is documented between the year 1963 to 1971. And they found the survivors are basically 26 to 30 years old. And with the open questionnaire, postal questionnaire, and telephone interview, the result was that 100% assessment was 60 or 51% have died, mainly disabled. 57 survivors, 84 of them are spinal fluid shunt, 70% have been IQ of around 80 and more. And some were able to drive cars, some can able to walk 50 meters and below. And only 26% have open employment. Thank you. This is a study done in Brazil, updated in 2022. What's interesting is that that this is the congenital malformation is still the second cause of fertility in the first year of life. This is a very interesting fact. And a cross-sectional studies in the Brazilian population with the fortification of the flour using the folic acid, and they still find it that there is a huge amount of spina bifida um, pre and post fortification of flour with folate. The data collected based on public database live birth information in the period of 1999 to 2004. That was a pre-fortification. In comparison to 2005 and 2010, the post-maize and wheat fortification, they fortified only two sections of the food, that is the maize and the wheat, which is the main staple food of Brazil, and plus cassava flour has been performed. And during the results, and it showed that there was a demonstrable after 5 years of studies, pre and comparing the before years and the after 5 years, the ratio or the PE value of the ratio of rate was 1.05 and the P value was 0.075. In comparing to the 10 years after additional of cassava flour, fortified for folate 45, the ratio was 1.4 and the P value was 0.01. So it shows that in spite of improving the folic acid, there's still relatable high amount of malformation. So they suggested to run a legislation to increase the concentration of folic acid and fortified food in fortified folic acid in all food. And there could be other factors involved, but this is a study, a very nice cross-sectional study is done in Brazil. This is a report of parents who are taking care of their children, spina bifida, during early childhood. This study was done with an affiliation of National Center of Birth Defects and Developmental Disability Center for Disease Control and Prevention, Atlanta, Department of Pediatrics, Orthopedic Department, Department of Clinical Sciences, University Hospitals, Department of Pediatrics, Arizona. Most of these studies are done in US. And what happens to the parents with children of spina bifida? And they have selected around 101 children belonging to these parents, and most of them are having meningocele and had a shunt done. And this study shows approximately how many visits they have made to a specialist into emergencies due to complications of shunts, and multidisciplinaries are involved. Just to explain that the cost of a child having spina bifida, even if the numbers are very less, the trauma that the entire team has to go through repeated operations and overcoming these complications of the child. Uh, my name is Dr. Radhakrishna. The aim and objective of this study is to reduce the amount of spina bifida. As a practicing doctor for 35 years, I'm an anesthetist, and during the normal labor, the post-delivery, and in the operating theater, there's one question always the parents ask: is my baby normal? So if we look at the spina bifida, what are the parents actually worried about? There can be a physical deformity of a leg or an arm, of cleft palate, or the most scary part, the parents are very worried, is a spinal defects like spina bifida or anencephaly. And in terms of post delivery, the parents are very traumatized by the experience of having a child with spina bifida, and they make a long journey with the child, and repeated hospital admissions, emergencies, repairs of the spinal defect. And as a result, sometimes these parents do not have a second child for the fear of another child having a spinal defect. And the other problem was that what we have seen in the maternity hospital that I work in is that we find sometimes on a scan they will see all these defects and end up in termination of pregnancies with the consent of both the parents. But even the termination of the pregnancy is traumatic because it could be the first baby, the first pregnancy. The other challenge that I seen in my medical career, and hundreds of doctors associated with me, is the cost of the journey along with this child, the stress, the fear. If only as a doctor, if these studies can show that methyl folate could be given for high risk patients with other comorbidities or areas of where we have not started fortification of folic acid, there is an understanding that we can enlighten more people from the ground level, from the nursing care to the doctors. Maybe we may fortify most of the patients with methyl folate with the consent of the government agencies. So it's a whole big journey to educate people with the current internet and the AI technology. We should be able to propagate better information through the media for the rest of the world, and especially in remote areas. Thank you, Dr. Radha, signing off. So the purpose of this study is to provide a comprehensive understanding of folate metabolism and the potential benefits of 5-methyl tetrahydrofolate as a possible supplement to reduce the risk of neural tube defects. And the second part will be the reduction of complications that comes along with neural tube defect. And a small change can become a big outcome to the parents, to the society, to the governments. Thank you so much. Dr. Radha signing off.